Now, for our grand finale, we have an exciting panel discussion on digital health transformation essentials, CIO and CDO perspective. This session promises to be a deep dive into the core strategies driving digital health transformation from the viewpoints of the top CIOs and CDOs. Our distinguished speakers are Ninad Rajesh, CIO at Health Assure, Neil Gomes, Chief Digital Officer, AmeriHealth Caritas, Arvind Sivaramakrishnan, CIO at Karkinos Healthcare. This session will be moderated by Mr. Girish Koppar, GMIT at Wockhardt Hospitals.
Thanks, guys. Thank you. And I know we need to. Yep. 24:55. We'll do it in 20. Okay, perfect. A lot of digital transformation. More often than not, starts becoming a IT problem. And that's unfortunately how it's perceived. So Neil, I'm going to start with you first for a perspective from the West. In terms of how do you bring the conversation of digital transformation, while it's got a lot of elements of grassroots technology to be done, which is why it is perceived as an IT problem, but that when it starts scaling, becomes truly an enterprise in nature. How do you bring this problem home to the core managing committee of the organization? When I say managing committee, the key leaders who run various verticals. How do you bring this conversation to everybody's perspective?
In my case, I use my past, which is education, and I try to inform and educate as much as possible. You have to build it into every narrative you have at the EC level, at the executive level, the business level, the ground level too, of where the work gets done. And then you have to also have the ability, I think another speaker had mentioned, to start pulling up ideas from the ground level, making your team's accessible. It's not just about educating down, but also getting educated up into the organization. I think that's really important because you'd be surprised. Most of the solutions exist within your organization. You just have to be able to pull those people, the right people together. So at a prior institution, and even here at AmeriHealth, I've invested in human-centered designers. Sometimes even hiring anthropologists, because anthropologists don't find anthropology jobs that easily in the US, but they're really good at going into physical environments. And healthcare is mostly a physical environment as it exists right now. And just observing stuff, right? And telling you things that most people will not even notice. And then human-centered designers talking to the people on the ground and finding out what the real problem is. Innumerable times we would get docs coming to us, administrators of units coming to us and telling us, oh, I have this great idea for a digital transformation solution. And we'd talk to them because otherwise they get upset if you didn't talk to them. And then we'd ask them, okay, who would use this thing? If it's the patient or member, or if it's an administrator or someone on the floor, who would use this thing? And then we go and talk to them, and most of the time, that was never a solution, whatever they came to you with. Okay, so you have to be able to take the educated folks also, who sometimes think they're educated, and test what they're saying with the ground level people or the people that are actually going to be using it. So I think to answer your question slightly long-windedly, I'll stay within time. It's not just educating down, it's also being sure that you're able to educate yourself from the bottom up. You have to do that. Yeah.
Good segue. Girish, question to you in terms of, Wockhardt has got a phenomenal culture. It's a long-standing organization, and like what Neil mentioned, a lot of solutions are there. Or I'm sure we've all heard it when we've met with the departmental executives, when we've done our rounds on the floor, in terms of, oh, you guys don't understand what it is and this is how it's done. So that whole aspect of you don't understand what it is. In order to drive digital transformation, one of the imperatives is to understand the current state of what I would call the method to madness of the existing organization, right or wrong. That's what the organization is running with today, and that's the part that we are looking to transform. So, Girish, from an organization that's got a lot of culture and pedigree, how are you working towards understanding the current state and kind of churning out what needs to happen for digital transformation? Because what happens in your organization may not be relevant to me. So how do you kind of, what are your driving principles there?
First of all, I would like to thank Vishnu and team for having me on the panel. Like initially when you mentioned, Arvind, it's an IT problem. So it was an IT problem, it was HIS. Now IT has moved beyond HIS. So whatever issues were there were more in the HIS and the transactional area. Now you see the organization having the BI tools, having the CRM, lot of other application built around the HIS. And the value is in that the application, not the HIS, but the other things, your dashboards, your CRM, where you are getting real-time data. And you can actually take decisions on that. Once the management has understood the value of the data, obviously HIS is the key source of truth or this thing. But then these applications are helping the top management to understand the trend, to take decisions real time or non-real time. So this is what we are working on. So this, because the top management is able to put a tangible value, okay, I have this application and based on this I'm taking a decision, what is the impact on the business, what is the potential loss. So they are able to ascertain and put a value. That is the key. If you are able to put a value to your digitization process, how much digitization is going to increase my top line or EBITDA. So that is what we are thinking on and we are working on as of now.
Ninad, I'll come to you in terms of, I'm going to now blow up this word essential. Okay. And what is essential? Money. And I think I wouldn't be wrong if I say that behind every successful CIO, there stands a CFO telling him that he is overspending money. I'm pretty sure that happens in every organization. If it's not happened in your organization, you need to relook at whether your organization is real. Yes. So I'll question your existence now. Okay. How do you bring in the perspective of the right spend and factoring that into the organization's financials?
Right, thank you so much. I think it's a pretty valid question. And I'll just kind of step back and talk about your first question, in fact, and then of course we'll dovetail into this entire aspect of financials and the CFO coming into picture. So the way in my opinion, the way I see this is, it's never a problem, it's an opportunity, right? So all issues, all problems ultimately become opportunities, and that's how we kind of should look at it, right? Now let's talk about the financials. Gone are the days, to be very honest, gone are the days wherein the financial wizards used to come really heavy on the technology, saying that why are you spending? Because the board is now coming into picture and saying, post-COVID, or rather during COVID and post-COVID, what are you doing? What are you doing next? For the betterment and for the growth and the benefit of our organization, we want to kind of use the technology, the power and prowess of technology to propel our organization to something different, to a different realm, to a different zenith, right? And to be very honest, now all the CXOs, along with the board, including the CFO and the technologists, in fact the digital technologists as well, strategy folks like Neil, they come all together, they collaborate, and to come out with a winning proposition, right? So it's all about collaboration nowadays rather than working in silos and financial wizards coming to the technology saying that, okay, don't spend, this is the only limit that you have. Currently, the way I see it, and this is exactly what happens within our organization and relatively a neo concept wherein people are willing to spend when there is benefit. So in the earlier days, we used to have CBAs, even today's day and age, those are quite relevant. So once we have the CBA in place, and this is a joint collaboration between all these authorities and officials, they come together, and then really the spend is never a spend. It's an investment. So nowadays, rather than spending, it's all investments, getting into utilizing the technology, whether it is the new Gen AI, the MLs of the world, RPAs of the world, and so on and so forth. It is in the interest and benefit of any organization to invest for the betterment and growth of the organization and the community at large as well, especially in the healthcare spectrum. We all are coming from the healthcare spectrum, right? In today's day and age, we talk about digital patient engagement, right? And that is where investments are getting into, right? So how do we equip all our customers, I wouldn't say patients, all our community members to come together and deliver the kind of outcomes, rather solutions, which are going to help the outcomes, and going to help the community members, the patients per se, to understand, to identify the ailments, the conditions, and how do we go about providing the kind of solutions which are going to make them live their lives healthier and better. So I think there's a paradigm shift in terms of the thought process, the mindset, the cultural thought process as well. I think we have come a long way as of now.
Again, if I were to expand the word essential, for an organization, what is essential is results, which is probably why nobody wants to take up a CIO's job, because what I was told about a CIO is career is over. So that's kind of what I was told when somebody becomes a CIO. So Neil, how do you drive the organization towards achieving results? Because ultimately the power of an initiative is as good as the outcome it's able to generate, and obviously the preferred option is the desirable outcome. Though we learn something out of the undesirable, I don't think we are mature enough as human beings to accept defeat. So how do you start working in terms of trying to drive towards results from an overall organization and for the IT organization as a branding entity? Because otherwise it's the most preferred punching bag. So how do you drive towards outcomes?
That's a great question. I think I'll give you my personal experience. So I've had the good fortune of working mostly with CEOs. So most CEOs, when I was at Tata Interactive Systems, I worked with Sanjay Sharma, who was the CEO there. At Jefferson, directly with Steve Klasko, was the CEO there. And at Common Spirit with Lloyd Dean and others. And now here at AmeriHealth. And there are 4 things typically that a CEO wants. And you said some of them. One is growth. So you have to be able to align your initiatives with growth, in some way. Sometimes you may feel like, especially in the technology space, I'm not going to produce the growth. The business is going to produce the growth. But you have to be able to catalyze that growth, right? And then bring the business along. You cannot just say, the business is not coming with me, or the business doesn't understand, or I'm going to get the CRM platform or something and install it, and now the business has to use it. No. The utilization has to happen alongside, right? And you have to contribute to the growth. Second is efficiency, cost reduction, improvement of processes, and there's so many tools on the technology side, right? Newer tools like process orchestration tools can help orchestrate processes across multiple different platforms and people. Think about travel, if you use Concur or something like that, how it simplifies that process, right? So efficiency is the second one that I've found usually. And if I align my initiatives, sometimes you can do more than one of these with one solution or project or transformation initiative. And the third is some form of innovation, being able to catalyze innovation. And because every CEO wants to say to the board that I'm not just operating in the now, I'm also operating in the future, right? And I'm presenting the future to you through my vision. And so you have to contribute to that vision, usually try not to, otherwise you'll reach in that situation that Vishnu was talking about earlier, where if you try to just do it on your own, then they may put the kibosh on the project, when it gets to the higher level. So try to do it with your CEO and first find out what is important to them and then build towards that from an innovation standpoint. And then finally, this is different from innovation. Many people think it's the same, is differentiation. Most CEOs are focused on competition, right? And they're looking around the space and the board wants to know, okay, we're innovating, that's fine. But do you know what the industry is doing? Do you understand what our close by, sometimes if you're localized, your competitors are doing? And are we beating them? So if you can answer those 4 questions, I feel, and do it well, then that's great. From an execution standpoint, there's just one solution in my mind, and that's be agile. Literally, like, do not do waterfall projects. They just don't work, in my point of view. Okay, and use the agile framework, use Scrum, use SAFe, scaled agile, and that will get you to the scale also. And then lastly, not just for execution, but for the continuation and sustainability of whatever transformation initiative you put in, invest in human-centered design. Because it gets you the information at the front end to find out what the real problem is, and the information at the back end after you've built the solution to find out whether it's working and keep it working. Yeah.
Now, you said one aspect of, we're designing for the future, we're just not in the now. But a lot of healthcare is about the now. Because the patient is right in front of you, the care is happening in front of you. As much as you are experimenting optimistically with the future, running the now in a very stable manner that is uncompromised is critical. Girish, in your hospital, the amount of crowd that's there in your health facilities, the varied nature of people that you see, being a high-end tertiary hospital, the varied nature of disease patterns and treatment patterns that you see. How do you balance between running the now effectively and quickly jumping towards, the future without compromising the running of the now? Because the running of the now is today's bread and butter. It's today's patients. They are right in front of you, flesh and blood, and no compromise on that, irrespective of your vision. How are you balancing the now and the future?
See, a good question, but what a CIO or the head IT should understand is the digitization easy understood the vision of the hospital? It should be very much aligned with the vision of the hospital. Like going to the COVID days when patients were not able to come to the hospital, yes, the business need was how to engage. So we started with teleconsultation. Now, again, when you see, if I understand correctly, if we want to start a peripheral satellite clinic. So unless you understand the vision of the hospital, you have the data. Again, when you were saying now the data is reviewed on a much, the frequency of data is very, very fast. It was weekly, now it has come to daily. You get daily MIS. So you have to actually make the top management the slave of the data. And so they actually start addicted and they say, yes. Second is, again, data has to be a 360. It is not only from a part. How you align the data, put everything into a data lake, and then get a 360. So the main point is, yes, the now systems are stabilized. What are you going to do? That is a continuous process. And the future is, again, once you have understood what is the vision of the management, suppose we want to start a tertiary clinic, or we have observed that the retention is not happening, the repeat patients are not coming. So how do we achieve that? So there has to be a brainstorming, why patients are not coming, where are they going, is there anything lacking in our social media? So first is the data. You have to have the data, how many are not coming, what is the gender, what is the geography. So unless you dissect the data and present it, that is itself the you are preparing for the future. Because the entire decision making is going to be on what data you provide. It's just a raw material to the thing. So that is the key of understanding what your organization wants to do and how you can provide that input to take a decision. That is what.
If I the other aspect of digital transformation, and the more enterprise goes digital, there are new products and services that are there. You're expanding your scope. You kind of, if I may say so, you're growing in the time and space dimension. You know, and that when that happens for an enterprise of any size, even a 50-bedded thing, governance starts becoming an issue, and especially with digital, governance starts becoming, because people are getting smart. You can do a lot of things, and you cannot do a lot of things. So governance becomes key. So how are you looking at building governance practices into your whole digital transformation journey?
I think it's the most essential element, to be very, very honest. And nowadays, especially because of this entire exercise and the act which is coming, right, the DPDP Act. Now, when we talk about health, it's not only the PII data, it's also the PHI data,
Yes.
right? And with the entire GDPR also, and then the HIPAA and the high-tech laws come into picture, the HL7 practices come into picture. So it becomes that much tantamount for us to make sure that security, data, privacy, governance, all these elements are baked into the entire strategy right upfront. You know, so when I talk about this, all these data governance practices, it becomes more essential for us to build this entire posture. Normally we talk about security posture, but here we're talking about this entire GRC principle, which means it includes the governance, risk, and compliance element as well. And when we talk about this governance, complete architecture has to be kind of strategies and then implementation as well. So execution also becomes key. Even before that, when we kind of sit across the table for strategizing, we have to bake this entire governance in picture. And of course, how do we do that is, you have to map the appropriate governance principles with the local laws. So if you're operating in the European Union, then of course GDPR comes into picture. In the US, the entire high-tech, the entire HIPAA comes into picture. And back in India, obviously, the Indian subcontinent, it's all about DPDP Act now, which has come into, in addition to combination with the IT Act as well, right? So there are enough and more frameworks which are available, which we have to kind of pick and choose for our appropriate organization. And if it is community, then obviously there are frameworks which are available across the board. So it's essential for us to map our strategies towards that, and then start implementing step-by-step procedures, which are again mapped to the principles of the governance rules as well. And then of course you sandbox it. Once you sandbox it, you test it, whether your strategies and the principles whilst executed, are they mapping appropriately, are they sort of behaving appropriately or not? And then once you have, then of course we'll derive a lot of learnings from it. And once we derive those learnings, then we actually go back to the drawing board, provide the resolution, make those changes, bring upon this transformation, and then roll out on an appropriate large-scale sort of a platform, you know. And that becomes, and that spells the success for any appropriate transformation sort of project. The another aspect is, when you talk about CIOs, right? Essentially, and this is a radical thought, right? Essentially, CIO is not a technologist. CIO is primarily a business person. For technologists, you have the CTO in place, right? So if we are a business kind of a person, then it's our responsibility to collaborate with the board, to show the board the appropriate sort of strategy and the philosophy behind it, and then drive that execution, that implementation, you know, and then bring about that change. That's where the entire philosophy of transformation comes into picture. So once you collaborate with the business, that's where essentially it's not technology transformation. We talk about technology, and the first question you asked about is the brickbats come to the CIOs, to the technology guys, right? Transformation is nothing to do with digital, to be very honest. Transformation is to do everything about business, right? So when we talk about a digital transformation, first and foremost, we will talk about business transformation, change the mindset, change the culture, change the behavior, and then dig deeper into the digital philosophy. Digital is just an enabler for the entire business transformation to come into picture, right? And the reason I'm kind of talking about this is, I have been tasked with the responsibility and I have the mandate of transforming the entire business, and digital is just one minuscule part of it, right? So business includes technology, includes digital, includes the forefront, includes marketing, includes a lot of other aspects as well. So when you talk about transformation, it has to cut right across the border, right across the board, and then include all these elements.
We're running close to time, And common complaint that I hear in most of the organizations is we're not allowed to ask questions to the CIO or CDO. They don't respond to us. So here is an opportunity where you can ask any question, but limit them to two. Any questions from the audience?
If there are no questions, either we were very good in our responses and discussion, or probably people haven't understood.
Or we went,
or probably it has all gone on top.
we went into the ether space.
Thank you.
My closing quick to all three of you. If there were two things that you will want to do and you will want to eliminate, what would those two be? You want to do something and you want to eliminate something. What would those be?
For me, it would be to make healthcare as accessible as possible, number one. That's my to-do. I think it's still very gritty. It's too hard, even in the US, anywhere else. It's very hard to get through. Too many steps, make it as easy as possible. What I'd like to do less of is on the execution side, what I said earlier, is to do less waterfall, more agile, and do less assumptions and more verification before you do something. So that's
Girish?
it. And great questions, by the way, I must say. Fantastic questions.
What I would like to do is standardize the processes, because the main hurdle in IT is processes are not standardized within the organization itself, because we have hospitals in different cities. So standardize the processes and educate the top management of how digitization can drive your business. That is, if you educate your senior management, your top management, as how important is data and how it can drive your business, that is what I would like to do. And what I wish, or I want to eliminate, is the layer between the CIO and the CFO. I wish the budgets were not controlled by the CFO, but by the MD or the decision.
Hear you loud and clear.
I have been in different zones altogether. So fortunately for me, I've never faced this cash crunch problem or the budget problem whatsoever. And God has been kind for that.
Send your CFO to my organization.
Yeah, absolutely. So to answer your question, what would I do or what would I wish to do is to drive the healthcare cost to a very negligible, if not free, but drive that cost element right at the bottom. Provide the best of the care, best of the treatment across the world, but at a negligible cost. Whether it's possible or not, I don't know. Whether it is possible, it's utopia. However, I feel that at some point in time that should be possible with all the technological advancements that are coming. Of course, technology also has its own cost associated with it. However, world over, I think the care cost, the healthcare cost has gone up. And of course in India as well, and in and around the subcontinent. So that's one piece I really would want to do by enabling via technology, right? The second one is what I wouldn't want to do, or rather what I would want not to happen, rather want to happen is the entire piece of the fear amongst the patients, right? Saying that, am I going to get well? Okay, say for example, God forbid, but if somebody is having a chronic disease, right, or life-threatening disease, so the fear in that person is, will I get well? So if I had a magic wand, I would kind of eradicate that fear, and then I would say that, don't worry, you are in much capable hands. Our doctors here, physicians here, are the best of the best, and they're going to treat you, and you will come out hale and hearty. Because we see patients in day in, day out, right? And the one thing that is on top of their mind is, am I going to be well or not at some point in time? So that is something which I would rather want to eradicate.
Healthy mind is indeed a healthy essence to a healthy body, and that means wellness. So with that, I think we'll have to come to a close on the session. Sorry, I won't be able to take this question now.
Just a quick question.
Yeah.
Actually, I'm very curious to know, what are the key metrics that you use to actually measure the digital success of your initiatives which you take? What are the key metrics that you use to measure that particularly?
Yeah, one metric out here is how many people have we saved?
Amazing.
You know, so that is I think that is the most critical and important matrix. Leave aside all your digital thing, leave aside all your business, leave aside your revenues and all. Were we successful in treating patients and giving out those outcomes, and have they come out hale and hearty? You know, so that is something I believe that should be the metric.
Thank you so much.
It's really, digital transformation is about getting the outcomes right. And getting the outcomes right, the very basics of it is, we are into healthcare, so let's deliver that healthcare properly. Thank you very much for being a patient audience, and thank you, my panelists.